Hey guys, tonight's workshop is going to be on fasting. We'll cover mostly intermittent fasting. Has anybody ever heard of intermittent fasting? Has anybody ever tried intermittent fasting? Okay, so I was fairly new to the concept, but I wanted to do more research, so I decided to do a workshop. So we'll cover mostly intermittent fasting, but we will cover what's called block fasting a little bit. So here we go. So this is what our topics are for tonight. We will cover a little bit of energy physiology. Sounds like a lot of fun, right? Intermittent fasting, what is it, why do it, and how do you do it? Block fasting, potential health benefits, fasting versus daily calorie caloric restriction, potential drawbacks to intermittent fasting, and fasting and exercise. So fasting is a normal part of several cultures and religions. It goes back many years. It's performed in Islam during Ramadan. They fast, I believe, during an entire month from dusk till dawn, I believe. Animals fast when they're sick. I notice when my dog doesn't feel very well, she will not eat her food in her bowl. She'll drink water, she eats grass for whatever reason, but animals they instinctively know not to eat when they're sick, and they do okay for a few days without food. And with critically injured or ill people, you notice in ICUs and things like that where people are very sick, they're not shoving french fries down their throat. They have their fluids, and the body does better in that situation without having to digest and worry about food intake. The body's able to heal. And sicknesses, stomach viruses, a lot of times we are told growing up in our culture that if you have a stomach ache or if you don't feel great, here, eat this cracker, drink this Sprite. And it's actually better if you have a stomach virus to abstain from food. Let your gut heal, let your gut rest, drink fluids, but it's not like you need toast and rice and bananas, all of that stuff necessarily to help you feel better. Fasting for medical purposes has been suggested since the time of the ancient Chinese, Greek, and Roman physicians. This is a quote by Mark Twain. He said, "A little starvation can really do more for the average sick man than can the best medicines and the best doctors. I do not mean a restricted diet. I mean a total abstention from food for 1 or more days." Which, he's a poet, right? So, what does he know? I'm just kidding. Definitely something to look into. So, to get into a little bit of energy physiology, glucose is our body's main form of energy. It's what our cells use to make ATP. Glucose is broken down in our diet from carbohydrates. So, when you think carbs, you think rice and bread, but it's also in things like fruits and vegetables. Our bodies can use the carbs in them. The brain, the neurons, most of them use glucose exclusively, whereas in the absence of glucose, other cells like muscles and other cells in the body can use fat, and that's where we'll talk about that a little bit more. Glucose, if we have an excess, if we have too much of it, we save it for a rainy day. We save it in the liver in the form of glycogen. So we take the excess glucose and we make it into a product called glycogen, and we tuck it away in the liver. When glucose uptake exceeds the liver's ability to convert glucose to glycogen, the liver uses excess glucose to synthesize fatty acids, and the fatty acids are released into the blood and transported to the adipose for storage. So basically that means if you have too much glucose and you don't need any more in your liver, you're gonna save it as fat, and then we'll see that as adipose tissue. Insulin, I'm sure everybody's heard of insulin, is it's anabolic, meaning it's not catabolic. It means it's a builder and it's not necessarily tearing down on like a cellular level. It's a small protein. It has a half-life of about 6 minutes in the blood. It's secreted very quickly, but if your body needs it again after about an hour after your meal, you can secrete more. It aids glucose transport into the cell. So, physiologically speaking, you should have not much glucose in your blood because you want enough insulin to take that glucose into the cell, and that's what the insulin is for. So you eat a carbohydrate meal, your body spikes insulin, takes those carbs that are broken down into glucose, and takes that glucose into the cell, and your glucose level in your blood should drop because of that insulin working and doing what it's supposed to do. So that's why if you think of somebody with diabetes and they don't have a working pancreas or they don't secrete enough insulin, then they're going to have high blood glucose levels because that insulin's not helping get that glucose into the cell where it's needed. And so ideally, you don't want your glucose in your blood, you want it in the cells where it's needed and used. So it aids the glucose transport into the cell. Muscle, liver, and other tissues use fat for energy, except when stimulated by insulin to use glucose. So those are the muscles, like we said, if we don't have a lot of glucose, if we don't have a lot of carbs in our diet, it's going to help stimulate, or in the absence of insulin, it's going to stimulate the body to use fat for energy. Insulin increases the synthesis of fatty acids from glucose, facilitates the entry of glucose into adipocytes, and inhibits the breakdown of fats in adipocytes. And then it could explain why there is obesity and insulin resistance, because if you have your cells aren't very sensitive to the insulin or not bringing the insulin like they should into the cell, you have a lot of glucose in the blood, and if you have excess glucose, it's going to transport that into fat and make more adipocytes. Does all of that make sense? I'm sure a lot of people have heard at least a little bit of that story. Growth hormone is another one that kind of plays into our insulin and glucose relationship. It's made and secreted by the anterior pituitary in the brain. It's called the protein spare. It helps with DNA and protein synthesis. It helps convert glycogen into glucose. So when we're short on glucose in our diet and we need to use some of that glycogen, this is going to help. And that glycogen is broken down into glucose, and then we can use it for energy. It helps in the lipolysis of fat, released in sleep, exercise, high protein meals, fasting, and mild stress. So they did a study that says that for a long time they thought that growth hormone was extremely beneficial in elderly, but I think they came back and kind of couldn't prove it again. But either way, it is stimulated and exercise and all these things, and it is needed by the body. As children, this is what helps kids to grow. And after your growth plates have been closed, you're using it a little bit differently. It stimulates the release of insulin as well. All right, so insulin resistance. Has everybody heard that term? So it's basically found in almost all of type 2 diabetics. It basically is a situation in which your cells are they're not responding to the insulin like they should. You have plenty of insulin in you're releasing the insulin, but the cells aren't responding to it. So I've heard it explained that I'm a mom, I'm a parent, so I get this illustration well. I think it was Dr. Dan POMPA that used it. So he said the insulin relationship and the insulin resistance is basically like me shouting at my kids and they have their ears plugged. And so instead of going to unplug their ears, I just shout louder and louder and louder. And it's the same relationship with if our cells aren't responding to the insulin, our body's just going to keep making more and keep making more. And in the presence of insulin, you have obesity. So that's kind of a relationship. It's kind of a double-edged sword. So in the presence of glucose in the bloodstream, after eating carbs, so you eat your carb-filled meal, you have that broken down into glucose, and that's in the bloodstream. The body releases insulin to take glucose into the cells. Cells in the pancreas measure blood glucose when it's high and will release insulin, which I thought that was really cool. There's these cells in the pancreas that are constantly checking your blood glucose levels. So how intelligent are our bodies that they we're able to do that. So if your insulin receptors on your cells are not sensitive to insulin, your body will keep making more. So that's like the analogy of my kids aren't hearing me because their ears are plugged, but I keep shouting and shouting louder. It's caused by an increased insulin persistently. So your insulin in your bloodstream is too high, too long. So it's not like I eat a meal and I have an insulin spike. That's normal. This is like I eat a lot, and I keep having insulin spikes, and it's too high for too long over a persistent amount of time. So we get insulin spikes every time we eat. So eating small meals throughout the day will keep your insulin elevated. So this is where it comes into a little bit of a disagreement with the nutrition experts that will tell you to eat small meals throughout the day. So they'll say instead of eating 3 meals, eat like 6 meals. So you eat all day long. So intermittent fasting, some of this will kind of disagree with that, that thinking that you need to eat more all day long, because you are, every time you're putting a handful of peanuts in your mouth, you're getting an insulin spike. So, and a lot of times we eat without even thinking about it. Like if we have a bowl of fruit, we grab a banana, or we as Americans snack a lot, and I'm definitely guilty of it too. So what happens for our bodies during a period of fasting or starvation? So physiologically, what's going on there? So in the absence of insulin or glucose in the body will use its stores in the liver and in fat. So first, we're going to use the glucose that we tucked away in our liver. We're going to use that first, and that's in the form of glycogen. So we'll break that down. It's will be broken down into glucose, and we'll use that. Your body stores about 1 to 2 days worth of glycogen in the liver, which is, like I said, again, broken down into glucose. And the amount of fat stores is going to depend on your body fat, how much fat you have, how much adipose tissue you have. Your body makes what's called a metabolic switch to fat burning. It's similar to the effect of the low carb or ketogenic diet. So they kind of go hand in hand. A lot of people do both. They'll intermittent fast, they'll skip breakfast, and then they continue to eat keto for the rest of the day. But they do go hand in hand, because if you deprive your body, if you do eat breakfast, lunch, and dinner, and you don't do any kind of fasting, and you deprive your body of the carbs, you're going to kind of have that same effect where you are going to go into those fat stores. You can use those for energy. So intermittent fasting. So the concept is having set blocks of time that you consume food and set blocks of time that you fast. And there's different ways that you can do it. So during fasting, you only drink water, coffee without sugar, or tea without sugar. So ideally you want water, black tea, black coffee. I think you can add like a splash of like coconut milk to your coffee. Different people say different things about stevia. Honey would be a no, because you don't want to add anything with sugar, because you're going to get that insulin spike. So the safest bet is to drink it black, if you like black coffee. You can set your fast for evening or morning. The simplest way for me to think about intermittent fasting is skipping the first meal or skipping the last meal. So you can think of it in time frames, or you can think of it in, I'm going to skip a meal. To me, it's easier to think of, I skip breakfast and I set my time to eat at 1. So a common form of fasting is 16 hours a day and only eating during the remaining 8 hours, typically on the same schedule each day. Another thing brought up when I was doing my research is you want to do it consistently for about a month. You want to give it a good solid 30 days before you kind of make any decisions about whether it's helping or working for you. Because your body needs that time to kind of adjust. So you can do 12 hours of eating, 12 hours of fasting, or more strictly, you eat 1 meal per day and fast the remaining 23 hours. That's a little bit harder for me to grasp, because that's literally eating dinner, and that's it. But a lot of people do it. It's kind of up to you. What this looks like practically is skipping a meal. So we'll go over, let's see, okay, I'm going to skip to this one. So a simple fast, 12 hours, cycle fast, 16 hours, strong fast, 16 to 18 hours, 19 to 21 hours is a warrior fast, and a full day fast is 24 hours. And a lot of times people that do intermittent fasting will throw in like a full 24-hour fast somewhere, maybe on a monthly basis. But that's just kind of a way to look at it. But if you skip breakfast, you've already slept, ideally 8 hours. Or if you skip dinner, you are about to go to sleep. So your sleep time is included in that. So that helps. So block fasting is longer periods of time just consuming water, broth, or whey water. So if it's intimidating to think of a water fast, some people do consume like broth, like beef broth, or whey water. Not positive where you get whey water from. Do you just add whey protein to water? Not really sure. So fasting is that period where there are adequate reserves by way of excess tissues, metabolic materials, and accumulated fat to sustain life without the necessity to draw upon essential organs. So during your fast, your body is intelligent and it's not gonna, a lot of people mistakenly think that you're going to start breaking down your muscle tissue and you're gonna start wasting away. And that eventually would happen if you fasted for, days and days and days and days and days, but in a short fast, that's not anything to worry about. Longer periods of fasting require more caution. So you definitely want to, if you have a doctor that you want to consult with, if you want to fast more than like a 24-hour period, then that would be a good idea. So we already know that. So benefits. Initially, I kind of viewed any sort of intermittent fasting as a way to cut calories. And it all goes back to some sort of caloric restriction. And at the end of the day, you could either cut your calories all day or you could skip a meal. And I kind of viewed them as equal because if you're looking at weight loss and diet as calorie in, calorie out, then it would be equal. Because if you skip a meal and you don't eat like crazy for those other 2 meals that you're eating, then you're going to end up in the same place as somebody that just monitors very closely what they eat. I'm not a huge fan of counting calories, so this is a little bit more appealing to me. But I was finding in my research that there's a lot more benefits than just weight loss. There's a lot more benefits of intermittent fasting than just cutting your calories. They're finding more and more about how it can heal the brain and how it can help with a lot of things. And we'll kind of cover the difference between the two a little bit later. But here are some benefits I found. I searched PubMed for all of my research. So these are peer-reviewed facts or peer-reviewed articles, I'll say. I didn't just make all of this up. So the first one is Autophagy. I always want to pronounce it Autophagy, but it's Autophagy. And basically, that's what happens to your body in a fast. And this is even when you're sleeping. Your body starts to break down unwanted material. And it's extremely important because as our cells age, we're gonna need to get rid of that. We're gonna need detox from that. If you've heard the saying, basically, a few years from now, you're going to be an entirely different cellular makeup because you're constantly making more and getting rid of the old. So that's that process. Intermittent fasting basically signals that process, which can be extremely helpful in situations where you need to get rid of some things that aren't quite working for your body, some cells that need to be got rid of. It can possibly increase lifespan. So they have found in calorie restriction that it can increase lifespan as well. A lot of professionals in intermittent fasting will say that intermittent fasting is better for lifespan, but either way, eating less is proving to be more beneficial than eating more. Weight loss and decreased inflammation. So when you intermittent fast, you're going to help diminish that inflammation. You're going to basically regulate that, and we'll go over that a little bit more. There's research on breast cancer, stroke, and blood pressure and seizures. I found articles on intermittent fasting and it helping with breast cancer, all kinds of crazy stuff. It doesn't decrease your basal metabolic rate, and calorie restriction does. So if you're restricting your calories for a certain amount of time, your body's going to kind of get used to that level, I guess, and kind of down-regulate how much calories you need to function. And then it's going to make it harder for you to continue to lose weight because your body's kind of adjusted to that restriction. With intermittent fasting, your body doesn't change your basal metabolic rate, so your calorie need for the day stays stable. That's what they found. Gut health, it can help with your gut health because you're not consuming foods. Your body's able to start the autophagy and diminish the inflammation. A lot of gut problems are from inflammation. It stimulates growth hormone. We talked about that a little bit, and what it does, it improves the biomarkers of disease. It reduces oxidative stress, improves weight loss, and studies have shown that you're not as quick to gain it back, which is important because with a lot of different diets that people do, you are quickly putting it back on. It promotes detox. It has been shown to not lower your metabolic rate. I don't know why I put that twice. It increases insulin sensitivity, and fasting could even help with loose skin during weight loss. So what they're theorizing in the research is that a lot of times if you lose a lot of weight, you have a lot of loose skin. So they're theorizing that your body during your fasting period is going to take that loose skin and use it and break it down. They're saying that if you use fasting and intermittent fasting to lose your weight, then you might not need the surgery like some people do to get their skin removed. I didn't do a whole lot of research on that, but I thought it was interesting that your body kind of uses that loose skin instead of having to get it removed. So this is from Dr. Dan POMPA. He does a lot of research on intermittent fasting, and so these things are the things that he spoke about in intermittent fasting and how it can help you. He says it turns on longevity genes and turns off inflammation genes. So then when it comes to diminishing inflammation, like I mentioned a minute ago, that's how. There are no glucose and insulin spikes. Bad cells do not adapt. So when you have cancer cells or anything that you don't need, they're going to be hungry and they're not going to make it, is what he's saying. Elevated ketones burn clean, heal the brain, and change DNA for the better, and stem cells are activated. So those are his big things that he covers with intermittent fasting. So we talked about autophagy already a little bit. So this goes into detail of what it is and why we need it and why it's a good thing to have it going on. It's a normal physiological process in the body that deals with destruction of cells. It maintains homeostasis or normal functioning by protein degradation and turnover of the destroyed cell organelles for new cell formation. During cellular stress, the process is upscaled and increased. It's not triggered in caloric restriction the same way. Autophagy during a fast triggers stem cell regeneration, and autophagy begins when liver glycogen is depleted about 12 to 16 hours into a fast. It peaks there and then drops after about 2 days. And I believe it's even triggered as you sleep. So if you're getting a full night's sleep, which is the key, then you do have some of this going on. And that's why it's so important that people get sleep, because it does help your immune system, it does help your body. A lot of times, our culture especially is really bad about getting a good night's sleep. So here are a couple people that have some really great resources if you want to do continued studying on intermittent fasting, because my workshop's kind of an overview, but they have great videos and great resources on YouTube. Dr. Dan POMPA, Dr. Jason Fung. Dr. Jason Fung has a book called The Obesity Code, and he wrote another book on intermittent fasting. He is a medical doctor, and he does a lot of intermittent fasting with his patients. He is, I think, a nephrologist. He has a lot of great information. Dr. Don Klum, and then, of course, PubMed is just a research journal, or you can look in the research journals for any sort of articles. So, risks. So hypoglycemia is kind of the first thing I thought about. If you're not eating, then your blood sugar is going to drop, especially for type 2 diabetics. They're not going to feel that great if they're on a fast. I know people that if they skip breakfast or if they don't eat something right away, they start to get shaky and jittery and they don't feel well. In the studies that they did with type 2 diabetics, they reported that none of them had any hypoglycemia. They reported that none of them had any issues at all. In all of the studies I read about it, if they were actual people doing it, they didn't have any sort of problems with it. A lot of the studies currently on intermittent fasting are rat studies, but there are a good amount too that they tested it with people. What are your goals? So this isn't necessarily a risk, but if you aren't looking to lose weight and you're generally pretty healthy, then this might not be the best thing for you. If you already are very, very lean, and you don't have a lot of extra fat stores to use, then it might not be what you need to do. If you are trying to build muscle and you're already lean and you're trying to build a lot of muscle mass, then eating might be better than fasting. So you have to think about your goals. If you're trying to become more insulin sensitive and you're trying to drop weight, there might be something that you can look into. Another risk, and this is something that I feel like I would definitely do, if I skip breakfast, I could potentially eat more throughout the day. So you have to be careful. You don't want to skip breakfast and then, I skipped breakfast, I can eat a gigantic lunch. So you have to be careful with overeating during your periods of eating because you're hungry. So it might help to kind of track your calories while you're kind of getting used to it. All right. So who should not fast? Pregnant women, breastfeeding women, and underweight women or men. Like I said, if you don't have a lot of fat stores to go by, you might not want to fast, at least not for very long. You would have the glycogen in your liver to use, but if you don't have a lot of fat stores, it's not gonna be great for you. So fasting versus calorie restriction. So we talked about this a little bit. At the end of the day, you would think that the result is the same, that you've decreased your calories for the day, and especially if you're exercising, you're increasing your movement. So you would think the result would be the same, weight loss, etc. Both have been shown to improve insulin levels, beta cell function, and insulin sensitivity. So if calorie restriction is more appealing to you, you are going to get the same effect as some of the same effect as intermittent fasting. You are going to improve your insulin sensitivity, especially if you're type 2 diabetic. That's going to be really important for you. You're going to improve your insulin levels and your beta cell function. There are a lot of benefits. It's a little bit more tedious because you have to track your calories very specifically, and that's hard if you have a few snacks and you're like, let me look up on my phone what a banana is and how to put that into my little app. They're both effective at weight loss. I did mention before that intermittent fasting seemed to be better at keeping the weight off. I just said that. So in one study, intermittent fasting was better at improving hepatic fat content as well as weight loss. Hepatic fat content is basically fatty liver. So that's a really cool concept if you have a lot of overweight people have a fatty liver, and intermittent fasting helping that is really, really cool. So research. Apparently I didn't finish my thought. Okay, so these are bullet points of different articles that I read and things I found interesting. Intermittent fasting may protect against age-related memory decline. There's also really cool implication with intermittent fasting. Even a single fasting interval, basically a good night's sleep, can reduce basal concentrations of metabolic biomarkers associated with chronic diseases such as insulin and glucose. So again, that's why I mentioned it's super important to get a full night's sleep because your body is doing a lot of things you may not even realize, but they're extremely important. Intermittent fasting improved morning fasted glucose levels and post-lunch or dinner glucose variability in type 2 diabetics. In the same study, they found a strong association between the increase in the hours fasted from baseline and the probability of attaining a normal fasting glucose level. In the study, they had 0 incidences of hypoglycemia. So again, in the studies they did with people and type 2 diabetics, there's several out there, they didn't have any problems with their glucose levels being too low. In a mice study, intermittent fasting was shown to improve brain edema decrease the infarct volume and improve neurobehavioral deficits in rats with cerebral ischemia. So basically rats that had strokes. So this is a really, really cool study because it basically implies that as we intermittent fast, our brain is able to heal. And it's a really cool concept if you think about, the rats had parts of their brain that were dead, basically, and they found that after periods of intermittent fasting, the swelling went down, and the infarct volume, basically the size of the dead brain tissue. So here is intermittent fasting compared to exercise. So you can imagine if you're doing both, you are getting a ton of benefits for both. Molecular profiling shows that most, if not all, brain regions are affected by aerobic exercise and dietary energy restriction, with changes in the expression of genes encoding proteins involved in synaptic plasticity, neurotrophic factors, signaling, cellular bioenergetics, disposal of damaged proteins and organelles, and cellular stress resistance. So basically, a fancy way to show that exercise is really great for our brain. And then if the studies are showing the intermittent fasting is able to help with brain issues as well, then the both combined could give really great benefits. So those are just some of the things that they compared between the two. We talked about insulin sensitivity is going to be improved in exercise as well. So if you take somebody with type 2 diabetes and they, with their doctor, work on intermittent fasting and start an exercise regimen, they could potentially be completely free of that because they've increased their insulin sensitivity, and then that helps level out their insulin levels. So it's got some really cool implications. So in conclusion, so this is basically to kind of wrap things up. Intermittent fasting and calorie restriction both have great benefits for weight loss, blood glucose levels, insulin levels, and insulin sensitivity. So kind of just depends on what works better for you. If you want to eat breakfast, but eat a small breakfast and count calories for the rest of the day, or if you want to skip a meal and that gives you a little bit more leeway when you eat the other two meals. Studies are promising, showing benefits to the brain and healing during an intermittent fast. So like I said, which one works better for you? Calorie restriction might be a little bit harder to adhere to. They did find over long term that it's a little bit more difficult to live with a calorie restriction because you're constantly worried about eating too many calories. So simply put, in the presence of excess, we save, and in the presence of little, we use our savings. So we have those stores in place, and we will use them. We just have to kind of make that switch from glucose using to fat using, and then it helps with weight loss, whether you're doing it through fasting or through calorie restriction.